Welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy. We are talking about plastic surgery. And the last topic, doctor, mini tummy tucks. First off, we've all heard of tummy tucks, but yes. What's a mini one?
So a mini tummy tuck is a tummy tuck for someone who just has trouble below the belly button.
Okay.
So if you cover up the lower part of your belly and you like the way it looks above, there isn't loose skin or anything overhanging the belly button, a mini tummy tuck will take care of whatever is down underneath. So it can take care of both loose muscle underneath as well as loose skin or loose fat.
Do you have to cut the muscle with a mini tummy tuck or
No,
always?
actually, with full tummy tucks, mini tummy tucks, we don't cut the muscle.
Oh, that's
what
nice.
we're doing is we're using the fascia, which is the tough layer on the outside of the muscle, as sort of to put an internal corset in.
Oh, I like
to
that.
kind of fold the muscle on itself, tighten it up.
That's perfect.
And often, especially with pregnancy, the muscles get pulled apart. They move off to the sides. And if we can put them back in the middle, it works a lot better. It holds all the guts in, so everything looks flatter. It's like the foundation to the abdomen.
So a lot of time after you have a baby, those muscles will not come back together naturally?
They will to a certain extent, but then they
But you
kind
need
of
a little
fall
help.
short. Yeah.
In a mini tummy tuck versus a regular tummy tuck, is the scar smaller? Or?
It's only smaller because we're usually removing less skin.
Okay, good.
But I've done, you know, quote, mini tummy tucks that have a very long scar because the problem was all low and it can be taken care of with a low scar. But maybe the loose roll of skin went all the way to the side.
Right.
So even though it wasn't a problem in the upper abdomen, it was a long problem down below. I need a longer scar. I don't have a skin shrinking ray.
I wish you
did.
did.
If I had something that would just
fantastic.
shrink wrap the skin, I wouldn't make any scars.
When are they going to come out with that, please?
They don't work well.
They don't?
No.
Too bad. All right, so then what is a recovery time for a mini tummy tuck as opposed to a larger one? Same?
Mini tummy, about half.
Oh, okay.
Tummy tuck, for mini tummy tuck, the recovery is more like liposuction.
Okay.
The full tummy tuck, for some reason, tightening that upper part of the abdomen slows people down more.
Gotcha.
So it's a little harder to get up and walk. Once you're up, you feel better.
And speaking of liposuction, what is the difference between liposuction, mini tummy tucks? How does that all, come together?
Yeah, I think of the mini tummy tuck as kind of a compromise between liposuction and tummy tuck because it can do some of the things that we get with the tummy tuck in terms of removing skin. We usually remove about half the skin between the belly button and the pubic region with the mini tummy tuck.
Okay.
So it helps with loose skin, which liposuction won't do.
Oh, okay.
But tummy tucks do. It also allows us to remove fat. Because we're not being as aggressive with the skin above the belly button, we can do liposuction there, which I tend to avoid with a tummy tuck.
Gotcha.
So a lot of times I'll use liposuction off to the sides to enhance the overall
picture
result. But I can get rid of that loose skin, which I can't with just liposuction alone.
Let's take a look at some pictures.
So you'll notice all of these above the belly button really isn't going to change very much.
Oh, yeah.
So where her belly button's coming forwards.
We lost our picture.
There's
number two.
Here's a front view. So you can see there's that lower roll of abdominal skin that's loose.
Our pictures are leaving us.
Well, hopefully we can remember. So if you're watching online, you can rewind.
There it is.
But there's a little bit of loose skin down underneath that if I just did the liposuction, it would become more loose and more irregular.
Oh, that's not good.
So what I'm able to do is just remove some of that skin, tighten it, pull it down. The belly button does get a little bit more vertically oriented when we do that. But it really helps. And the upper part of her abdomen looked great.
It did look good.
I don't have to do anything.
That looked really good. And the scar was hidden. So she was wearing underwear, and the scar was hidden.
So the scar is very low. I always try and keep it well below the bikini line.
And we saw that picture number one. I know it went away pretty quickly. But what did you do there?
So she's a little bit bigger.
Right.
Has a little deposit of fat down underneath. But the lower part, her muscle was more loose. So I tightened the muscle, removed that skin, fat, and just tightened everything up. Because her biggest problem was that roll at the bottom was interfering even in clothing.
And so then you just tighten all the skin up and you're ready to go. And the scar will fade.
The scar fades with time. Again, takes about a year. I'm using...
We gotta go.
Oh, okay.
We gotta go. All right, we're out of time, Dr. Mealy. We've got all of the doctor's information right there on the screen. It's been fun, but it always goes so fast. Thank you so much, Dr. Mealy, for joining me. Thank you for joining us on Body Beautiful. We'll see you next time.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.